Yes, it's time for the SMX medical update. It's not the SMX dental update. We do bring in Dr. Joe McGinley from the McGinley Clinic. Anything you can do for a cracked tooth, chipped tooth, anything you could provide advice for Eli Tomac there?
For once, I'm at a loss for words. I can't really help with that one. Find a good dentist that's going to make that look good and not a hillbilly smile, I think is going to be the way to go on that. Unfortunate, but no, Weege, I can't help with that one.
Some dentist is going to offer it, though. To just have the picture on the wall of the 8-time Daytona winner, I fixed that tooth. I don't think Eli's going to have a problem finding someone that wants to help him. JT, we did see another injury, though. Unfortunate. It was a great night for Drew Adams, JT, but it ended not the way he would have wanted it.
Yeah, so it sounds like he has a broken thumb, and I'm sure we'll learn more as the week goes on here. But I wanted to ask Dr. Joe, kind of, he mentioned he wants to go racing, right? So we don't know if that's even possible. But when you hear broken thumb, what do you immediately think of will be the challenges that could preclude him from going racing, or maybe something that he would need to basically have a surgery on? Like what would be the indicators there for you?
Yeah, there's a wide range of possibilities here with a thumb injury. So the biggest one that comes to mind, we've talked about it with some of the other riders in the past, is if you have a fracture towards the base of the thumb, you can also have a ligament injury of the UCL. And when that happens, you can have instability, you can have problems with grip, and that fracture can even move and go into atypical places around that joint. So a lot of times, if it's on that end of the spectrum, you'll end up needing surgery, like we saw with some of the riders from this past year. If it's a more traditional fracture along the sort of long bones of the thumb, those can sometimes be managed with conservative care. Now, no matter what, it's not going to feel good. So if Drew Adams decides to end up trying to get on the bike and ride, it's going to be painful. You're going to have to deal with the anti-inflammatory protocols. You're going to have to try to get some mobility to the thumb. So UCL tears and fracture fragments would be my number one concern. And then second thing is mobility of the thumb and the ability to grip and actually ride the bike in a comfortable manner where you can go out there and compete.
You know what's interesting? Yes, so Cooper Webb 2 years ago, battling Jet Lawrence for the title, injures it, can't heal it without surgery. And then apparently last offseason, going into 2025, injures it again, but it was able to heal on its own. So what's the difference sometimes with what sounds like a similar injury?
Yeah, it depends where the injury is, how much of the ligament's involved, if that fracture fragment. We're talking about the UCL in this situation, which is at the base of the thumb, the ulnar collateral ligament. And that provides major stability of that joint. So depending on the location and the extent of that, and if that fragment's moving around and if that ligament's unstable, that's what determines whether surgeries are needed or not. So it's not just the imaging. So MRI and X-rays are definitely necessary, but then clinical exam, whether there's true instability of that joint. Because what you don't want happening is when you're out there riding and then you can't trust that joint, you can't trust that thumb to be able to grip the handlebars, and then you have even a minor bobble and then you can't hold on. And then you make things worse, right? So when that happens, you could dislocate the joint, you can cause other injuries inside there. So it's a combination of the injury and physical exam to determine if that joint's stable and the extent of ligament versus bone damage.
Bummer for Adams. That was the best riding we've seen from him really as a professional. Fastest qualifier, won his heat, fixed the starts, and then ends like that. So we'll see what his long-term prognosis is. Anyway, thanks for the intro, Dr. Joe. We'll see you at the races.
Thanks, guys.